the session on Introduction to Pharmacokinetics and Absorption of Medications. So in this video, we are going to cover the introduction part, and the next video we are going to cover the little bit about the absorption of medication, and the rest of the kinetics we are going to cover in another. All right. So pharmacokinetics, so that means you should know what is pharmacology, how to study. So I have created another video how to study and how to remember how to approach the pharmacology. So you can watch that video, then you can watch this video, then it makes a lot of sense. All right. So you can see a lot of the dosage forms like ampoules and capsules. Let me take the pen here. So let's take purple color, and also very attractive colors of capsules, pills. And the textbook, this is a lighter version of Cadgen, Brenner's, and Stevens Pharmacology. And the recommended standard textbook for board exams, the Cadgen Basic Clinical Pharmacology. Okay. And another book we have, the Goodman-Gilman, that's a big one. So if you are okay with that, you can go with the Cadgen, or if you want a lighter version, Brenner's Pharmacology also. All right. The session learning objectives. So we are going to first see the terminologies, some definitions of what is pharmacology and what is pharmacokinetics, what is pharmacodynamics, and drug or medication bioavailability, first cause effect. And I'm not covering all the definitions. You guys can refer the textbook. There are a lot of definitions. Those are self-explanatory. And identify the sources of drugs, where you get these medications, how we are going to prepare. Just brief introduction about what are the different sources of medications. Again, the terminology, drugs, medications, medicaments, all are same. So we can use interchangeable. Explain the process of absorption of drugs. Explain the various pharmaceutical preparations or dosage forms. And compare and contrast the routes of drug administration. And compare and contrast the drug names like based on their chemical, generic, and brand names. Okay. So these objectives we are going to cover in two parts of it. All right. So the outline, so we are going to see the definitions, then history of pharmacology, drug sources, major divisions, and the dosage forms and preparations, absorption mechanisms, and first pass metabolism, bioavailability, routes of drug administration, drug names, and summary. All right, so let's start with the first one. What is pharmacology? The pharma means medication. That is a French word that came from like a herb. French mean the pharma means herb, but it's now we consider as a medication, right? Because in the past we use a lot of herbs as a medications, correct? So now in the last 100 years, we develop a lot of synthetic medications, right? So the pharma means we consider the medication drug. Lazy means the study. So we are studying about the medications, how they interact with the living systems, either human beings or the animals, right? And by binding regulatory molecules like receptors, enzymes, and how whether it is activating or inhibiting normal body process. That makes a lot of sense, right? So when you when you're a normal healthy person, you're fine. So for example, you have increased blood sugar, so that's abnormal, right? So you have to inhibit that increase in blood sugar. So that's what the inhibition. For example, you have hypoglycemia, you have low blood sugar, you have to activate to some systems like your gluconeogenesis, glycogenolysis, to bring the blood sugar normal. So that's what the pharmacology is, modulates the body functions. You want to increase or decrease to maintain normal function. Pharmacokinetics. So again, the pharma means medication. Kinesis means movement, right? So kinesis means movement. So the drug movement, so where it moves in the body, like if you take the pill in the mouth, so it goes to the gastrointestinal tract and the intestines, absorbs the liver and goes to the systemic circulation, right? So kinesis means the drug movement. So where the drug movement in the body. So when you take a pill, think that so that has to be absorbed, distribute, metabolism or biotransformation, excretion or elimination from the body. So that is called ADME pathway: absorption, distribution, metabolism, elimination. It is considered as a pharmacokinetics. Kinesis means movement. What movement? Drug movement. Where it moves in the body. So ADME, absorption, distribution, metabolism, excretion, ADME pathway is pharmacokinetics. Next one, pharmacodynamics. Again, we know that pharmaco means medication, dynamics means action. So how the medication produce its effect, mechanism of action, like the study of actions of drugs by binding the regulatory molecules like receptors, enzymes, right? And they produce effect, response, effect, efficacy, potency. Then while producing the effect, they may cause adverse effects also, side effects, toxicities. So this is comes under pharmacodynamics, the medication or drug action, receptors, enzymes, mechanism of action, that is pharmacodynamics. Just analyze the terms, you get the meaning. You don't need to memorize. Okay. So we got pharmacology, pharmacokinetics, pharmacodynamics. Good. All right. Next one. So medication we already discussed. So this is a mainly we use interchangeably like medicament, medication, or sometimes we call agent also. It's the same, right? So agents, that is also medication. Okay. And next one, bioavailability, right? So bio means life. So availability, so, right? So what availability? The medication. So where it is availability? In the circulation, right? In the systemic circulation. The fraction, right? So the fraction means percentage. That is a F. Bioavailability termed as a F value. That is a fractional extent to which a dose that of the drug reaches its the site of action, biological fluid or systemic circulation, right? So that is the bioavailability. So take example of when you take a pill like a 500 milligrams of acetaminophen by mouth, oral route. So systemic circulation, maybe you may get like 300 milligrams. So 200 milligrams is metabolized before crossing like gastrointestinal tract or liver. So that is the first pass metabolism. So that means the oral route, so there is a decrease bioavailability. So you are not giving entire 500 milligrams, it won't reach systemic circulation. Whereas some route of administration like intravenous route, IV, you are giving entire medication to the systemic circulation. So that means IV is a 100% bioavailability. Make sense? So because we're talking about the bioavailability, we mentioned that first pass effect, right? So what is first pass effect? So that means the medication, right? So we are all talking about here how the drug is absorption, right? So we are talking about you take the pill, how that the medication is going to cross from your gastrointestinal tract or from the site of administration to reach the systemic circulation, right? It should cross several layers. So that is the first pass effect, right? So in the first pass effect means, for example, you take a pill. So this is a gastrointestinal tract, right? So it has to cross this membrane. So while crossing in these enterocytes, you have a lot of enzymes. For example, like cytochrome P450 enzymes, they metabolize, right? So that's what out of 500, you get only 300 in the systemic circulation. So that is called first pass effect. So that means metabolic or excretory capacity of the liver and the intestine of the drug is a very large, right? So that's what the bioavailability is going to be reduced, right? So except IV, all other routes, there is a first pass effect. And take sublingual, give IM, right? Or take pill, ointment. So before reaching into the circulation, so some medication is going to inactivated or metabolized by these enzymes. That is called first pass effect. So that is why some medications we don't give oral, like nitrates, high first pass metabolism. So we give sublingual. So some medications like completely destroy the, like insulin, if you take orally, it's completely metabolized. So you have to give injection. Okay, so here is the question. So which of the following process are not covered by the term pharmacokinetics? Pause the video, come up with the correct answer. Alright, so we are talking about pharmacokinetics, right? So pharma means medication, kinesis means movement. So what movement? So drug movement, where it moves in the body. So I think you guys got the correct answer. So that is the so the which of the following is not covered, right? So that means the movement related to which one? So the first one is pharmacodynamics, right? So this is the molecular target binding, that is the pharmacodynamics. So broken down in the body, right? So that's the oral route, right? So that is a kinesis. Removed from the body, excretion or elimination. Gets into the bloodstream, that is the distribution. And move around, that is also distribution, right? So this is the pharmacokinetic processes. All these four pharmacokinetic processes. So which is a not is that is pharmacodynamics. All right. So pharmacology. So mainly just introduction, couple of words about the introduction. In the history, we know that earlier, like if you go for 200 years ago, we don't have much medication. After the scientific advancement and the machinery and the technology, so we are able to isolate a lot of active principles from the crude plants or minerals, biological source like DNA recombinant technology. So in the earlier days, where they used to have cool mud and soothing leaves, herbal products, natural products like castor oil, opium, herbal medications, especially the morphine is isolated in the 1804, right? So, and later on we developed a lot of the opioid related medications like fentanyl, sufentanil, alfentanil. Also, the pharmacological experimental advancement leads to a lot of isolation of pure compounds, irrespective of using of uh, crude extract. So we can isolate what is the exact active principle from the plant. You can use that one. And the goal of pharmacology, main thing you have to understand the mechanisms of the drug, how they interact, what is the target receptor, how it produces a response, why the aspirin produces antiplatelet effect, why the clopidogrel produces antiplatelet effect, how the paracetamol binds, inhibits the prostaglandin, right? So that's the targets mechanisms most important. Then you can choose the appropriate pharmacotherapy, right? So that is based on once you understand that disease pathophysiology, you can choose appropriate medication that is based on the guidelines or evidence base or FDA approval. So we can use those medications. Some medications we use off-label use also. And also you have to predict the adverse effects, drug interactions, especially the important ones. And also you have to identify contraindications. Some medications, especially in the pregnancy, there is a contraindication. So patients with diabetes, some contraindication. So you should know the contraindications. And you have to know only the generic names. So in the exams, we don't test you the trade names. Okay, for the exams, only the generic names. And also you are able to interpret the graphs, especially sometimes with EKGs or dose response curves or the values of various hormones. You have to able to interpret those graphs, images related to pharmacology. All right, so where these medications coming from? So there are three important sources. Number one, natural source. As I mentioned in the previous slide, the morphine, it is a opioid analgesic. So that is isolated from papaver somniferum. There are many natural sources like alkaloids, atropine, pilocarpine, physostigmine. There are many natural sources. And biological source like penicillins from the microorganisms and insulin from the biological pancreas or DNA recombinant technology. Whereas synthetic, that is the chemically, we use medicinal chemistry to synthesize these chemical compounds like acetaminophen, ibuprofen, like pain medications. And the pharmacology, there are two major divisions. So we know that number one is the pharmacokinetics. So pharmacokinetics mainly deals with the dose of medication and the absorption, distribution, metabolism of medication. That is the kinesis, movement of medication. Pharmacodynamics, action of drug. That is the mechanism of action, drug effect, receptor binding, signal transduction, and the response. So make sure you know these two major divisions of pharmacology: pharmacokinetics, pharmacodynamics. All right, so pharmacodynamics, absorption means the mechanism for a drug to reach the systemic circulation. That is A. The D, distribution, the mechanism of drug to reach the target organ or tissue. For example, you gave the medication to treat some infection, maybe the infection at the leg. So you gave the pill in the oral route, but that going to reach your feet via distribution. And metabolism. So once the drug is produced, its response, how it is metabolized, right? It converts into water soluble, excreted from the body. So mainly in the liver. Metabolism, also known as biotransformation. Then excretion, how it is removed. So removed through the urine or saliva or through the lungs, air, sweat. So the various routes. The major route is the mainly from the kidneys. And here is the picture. You can see the first process in the pharmacokinetics: absorption, then distribution, metabolism, elimination. All right. So in the absorption phase, when you give the any dosage, for example, you give the pill that goes to stomach and it disintegrate and becomes solution. It absorb into the circulation. Then it binds to proteins, plasma proteins. When the plasma protein that does not cross the membrane. When the free form of medication that crosses the membrane goes to the site of action, it produces response. Then it binds to the proteins, it does not cross. But this process is reversible. It binds and releases slowly. That acts like a reservoir of medication. So once its response is done, then it is excreted in the urine or bile or feces, sweat, saliva. And some medications, they stay in the body for months and years because they binds to the tissue proteins. So that is the accumulation in the body. So that some medications they do that. And let's talk about the what are the different types of dosage forms. So I'm not going to test you in the dosage forms. Okay, so this is just to understand what are different types of dosage forms is available to treat various disorders, right? So patients prefer some, especially pediatrics, they prefer syrups, right? So they prefer like liquid dosage forms. Or sometimes you have like a nasal infection, you need nasal drops. Or sometimes ear infection, you need ear drops. Sometimes uh, ear infection, you need ear drops, right? So that's local action. Whereas we have the powder dosage forms. So that means these are solid dosage forms. So you can give these powders some antibiotic powders. You can use like external curds or like antifungal powder dosage forms. That is solid dosage forms, right? And also in the solid dosage forms, you have a pill and a capsule, hard gelatin capsule, soft gelatin capsule or caplets. Okay, so these are solid dosage forms. So this is a pill, this is a capsule, right? And so we have the parenteral injection forms. So that is this is called ampoule, single dose preparation. You break the ampoule, give the one administration. This is a vial. You can give multiple administrations. So this is the insulin cartridge, especially for the diabetic patients. These cartridges filled with the insulin. So you can give multiple injections. So we have IV fluids like of liter, like 500 ml of fluid, so you can run the IV fluids. And also we have paste and creams, ointments, gels, and also we have the inhalers, acute inhalers for the bronchial asthma patients. Each actuation, it will deliver the medication in the powder form, in the vapor form, to the directly to the lungs. And also we have suppositories, you can give directly to the rectal or vaginal or urethral for local action. And also we have transdermal patches. You can put the patch on the skin, it will deliver the medication continuously over a couple of days or weeks. So when you give the patch, it will produce a continuous action, right? So when you give the pill, it will produce a response, then excrete it. And also we have IV preparations. You can put the IV line. We have intramuscular and inhalational and deep intramuscular. So we are going to see all these different types of routes of administration, advantages and disadvantages in the next week. All right. So then how these drugs crosses the membrane. Okay. So we learned this one, the crossing the diffusion of the ions or water, how they crosses the membrane. There are four. The number one process mainly through the filtration through the pores, like water soluble substances, they travel through the pores or filtration. And lipid soluble, they crosses the membrane, or they may use the uh, crosses the membrane and goes to the another inside the cell. And we have facilitated diffusion or active transport. This is a facilitated diffusion. Use the carrier molecule and transfer the substances from one side to inside. And also active transport utilizes the energy and transfer the substances from one side to other side. And also we have endocytosis. For example, the molecule is a bigger size, so it cannot cross the membrane, so that they engulf the molecule and deliver it to the inside. So that's like vitamin B12 or botulinum toxins. Those are by endocytosis and exocytosis mechanism. So which form of medication crosses the membrane? The free form crosses the membrane, not the protein bound. Non-ionized state, that is lipid soluble. Non-ionized means lipid soluble crosses the membrane. Okay, so molecular weight size also should be less than like 1,000. If the molecular size is huge, then it won't cross the membrane. For example, alteplase is a fibrinolytic medication. It is a heavy molecular weight. It does not cross. You have to give IV, right? And also we have heavy molecular weight heparins. You have to give IV. So those are high molecular weight. All right, so let's test our knowledge. A 43-year-old man with the gout was administered oral aspirin, which weak acid with a pK of 6. Which of the following enhances the absorption of aspirin by crossing the plasma membrane, right? So this is the weak acid. So most of the medications either weak acids or weak bases. We are going to learn all these ionizing principles in the next video. All right, so pause the video, come up with the correct answer. I hope you guys got the correct answer. So which one enhances the absorption by crossing the membrane? So that's the correct answer is non-ionized. That is the lipid soluble state. Lipid soluble, non-ionized. Ionized means water soluble. It won't cross the membrane. Water solubility, so it's a decrease absorption compared to lipid solubility. So lipid insolubility, so it's difficult to cross, right? So lipid soluble, more crossing compared to ionized or water soluble or lipid insoluble. All right, so these are the references, the Brenner Stevens pharmacology, Cat Jung basic clinical pharmacology and first aid, and we'll be continuing the next video. Thank you.